Good afternoon and welcome to the St. Clair County Daily Briefing. Today I'm joined with EMA Director Herb Simmons and we'll get right into our numbers. In St. Clair County, we have tested 309,749, which is an increase of 909 since yesterday. For positive test results, we've received 29,241. That's an increase of 43 since yesterday, and those are males and females under the age of 10 up to their 90s, which brings our daily county positivity rate to 4.7%. For negative test results, we've received 280,508. Sadly, today we are adding 2 additional COVID-19 related deaths, bringing the county total to 469. And they were a male in his 60s and a female in her 80s, both who had unknown health conditions. And our sympathies go out to their family and friends. For those that have completed their IDPH required 10-day isolation period, we're at 28,360. For state totals, they've tested 19,972,391, positive tests received of 1,232,900, which is an increase of 3,002 since yesterday. For deaths in the state, they've had 21,203 COVID-related deaths, which is an increase of 32 since yesterday. For hospitalization numbers, St. Clair County hospitals have 29 patients admitted due to COVID-related illness, and 3 of those patients are on ventilators. Regionally, there are 65 patients admitted due to COVID-related illness, and 4 of the patients are on ventilators. For our congregate living facilities and outbreak status, these are cumulative numbers and we'll only announce the changes today. And the only change we have is Cedar Trails of Freeburg has 41 cases and 4 deaths, and that is an increase of 1 case. I will now turn it over to Director Simmons for his update.
Thanks, Brian. Appreciate it. We'll go into the zip code report today. 62201 goes up 1 to 577. 62204 goes up 1 to 397. 62206 goes up 2 to 1,304. 62208 goes up 2 to 1,638. 62220 goes up 3 to 2,091. 62221 goes up 3 to 2,799. 62223 goes up 1 to 1,773. 62225 goes down 1 today to 141. 62226 goes up 2 to 3,221. 62243 goes up 3 to 783. 62254 goes up 2 to 804. 62255 goes up 2 to 84. 62258 goes up 4 to 1,066. 62260 goes up 1 to 806. 62269 goes up 2 to 3,287. And 62285 goes up 1 to 581. As Brian said, we had our county positivity rate's 4.7 today, Brian, which is down just a little bit from yesterday to from 4.8. The regional positivity up to 3.2 today. The county 7-day rolling average is 4.6. The other counties came in today. Bond County at 0%. Clinton County 1.1%. Madison County at 6.6. Monroe at 9.5. Randolph at 4.1. St. Clair came in at 2.2. In Washington at 0%. Brian, testing is still available out there, but before we talk about that, we had some news come in today from a press release from IDPH.
Yes, sir. So IDPH announced today as part of their aggressive actions to battle some rising COVID, they were going to have mobile teams to go into hotspot areas. And one of the other stipulations is they allowed areas that have the capacity to go ahead and expand the requirements for who is eligible for vaccinations. And we were able to do that here in St. Clair County.
Well, in talking with our health department deputy director, Mila Blanford, We have the capacity at the Mass site. We're scheduled to do just right at 3,000 today. And with the expectancy of more vaccine coming in next week from the federal government to the state is allowing us to do that. So now is your time to go in if you're 16 years of older of age and get on the site and just sign up.
And it's important to remember the only vaccine that's approved for 16 and 17-year-olds is Pfizer. When you log onto the website, you see we do have Pfizer at the MassVac site, but there are also some clinics that have been listed for Moderna and Johnson & Johnson at our 330 West Main site. So you just have to make sure that when you're doing that, if you're 16 or 17, you're signing them up for a Pfizer dose. We'd hate for you to show up at 330 West Main and get turned away because you're not old enough for the FDA-approved Moderna or Johnson & Johnson. But we are happy that at this point in St. Clair County, we've done tens of thousands of vaccines. We're doing, as you said, 3,000 today, several thousand every day to continue, and now it's unrestricted. You must be a resident of Illinois or work in Illinois, but we can get you in and get that shot in the arm.
Well, on the IDPH press release that I got today, Illinois is taking aggressive action to address the first signs of a possible resurgence. As you look around, the news media is reporting several states are starting to see an uptick.
Yeah, and here in Illinois, they've seen some up in the Region 1 area and Cook County that they're seeing an uptick both in cases and hospitalizations, and we don't want to go backwards. And that's why they mentioned they're also going to be sending out those vaccination teams to do a quick pop-up in those troublesome areas to try and get as many people vaccinated as quickly as possible. One of the things we've been lucky as with our mass vaccination site, we can continue to expand. As long as the vaccine's available, we can continue to increase that number and get thousands of people a day through there. And, they do have to come back 21 days later to get the second dose, but just that first dose gives them a decent amount of immunity to this virus.
Yeah, there was another report came out today talking about the Pfizer's actually even more of a protection than what they first thought on just the first dose alone. So we'll be talking about that some more. But, testing is now just as much more important now as before because of these possible upticks. So, the site at Fairview is still open.
Yes, it is. It's open Monday, Wednesday, Friday, and Saturday from 8 to 4. And we also still have testing occurring at the pharmacies, express medical facilities. Just as we say vaccinations are available, testing is widely available still as well.
And the other point that we've been pointing out this week is the last several deaths, and it's always a bad topic to talk about, but we've had two more in the county today. One of those being in that 60 age range there. So last week we saw several of them in those 50s and 60 age groups. So now it's more important now because, as we've been saying for 378 days, this virus doesn't care how old you are, doesn't care where you live, and it's still here. It's real active still.
It is definitely still here. Affected another 43 people today. Hopefully most of them will have mild symptoms and bounce back very quick, but it's certain that some of that group of 43 will have severe illness.
The region's hospitalization went up 12 overnight. So those are the kind of numbers that we keep track of each and every day, the health department, and they send them over to us. So again, everybody is working hard at the health department, at the mass site, at the hospitals. It's as we've been saying now for 378 days, it's Team St. Clair. We're all in this together for each and every one of you that get tested or have been tested and are healthy. Please continue to try to do so. Those of you who haven't received your vaccine yet, now is your time to go on the site, 16 years or older. As Brian said, make sure you check which vaccine is being dispersed. But we want everybody to get a needle in their arm because that's how we can stop this spread of this virus. We're watching closely of these other states and even here in up in northern Illinois where they're starting to see an uptick. So continue to do your part. Help us stay on top of this because for 378 days we've all been in this. We've went through all of it. We're getting closer, but we surely don't want to go backwards, as Brian said. So Let's pass the word, tell your friends, your neighbors, family members. If you haven't got your shot in the arm, go on and sign up and come on down to the fairgrounds and get the needle in the arm and start being a further part of the solution of getting this virus put behind us. We'll be back with Cindy in a few moments to translate this into our Spanish communities, and then we'll be back tomorrow afternoon for day 379. Everybody have a good evening. Thank you.
I have battled this virus both professionally and personally. Professionally, I can tell you firsthand that it's greatly impacted our community, caused the loss of many lives, and continues to spread today. Personally, I can tell you that I contracted COVID-19, and it definitely is not the flu. This virus affects everyone differently, however, many have severe consequences. Please take this time to help your friends, your family, your neighbors, and the entire region by wearing a mask, washing your hands, and watching your distance. Together, we will overcome this invisible enemy.